Before we begin, please note that this content is for educational purposes only and does not constitute medical advice. Always consult with qualified healthcare professionals for caregiving decisions. In an emergency, call 911 immediately. Welcome to Lesson 14 of the Family Caregiving Program. I'm Dr. Thomas Scotton's avatar. Today, we're focusing on a vital skill, monitoring for changes in condition. Our goal is to recognize meaningful changes, decide how urgent they are, and communicate clearly. If you remember one thing from today, let it be this: notice the change, report it accurately, and act. We will cover how to describe a baseline and monitor key health patterns. Then we'll learn to recognize warning signs and choose the right level of help. To notice a change, you must first know what is normal. A baseline is the usual condition when stable. This includes thinking, function, intake, elimination, and any existing symptoms. Describe their thinking. Are they usually oriented? What is their typical mood and memory level? Next, document their function. How far do they walk? Record their typical appetite and sleep. Record their usual measurement ranges like blood pressure or glucose, not just a single reading. A dated baseline prevents a vague, they just seem different from being dismissed by clinicians. Monitoring should be purposeful. Start with a simple greeting and observe their alertness. Ask open questions like, "How do you feel today?" And then listen without leading their answer. Track for important trends every day, starting with weight and appetite. Then monitor their sleep and mood. These are often where changes first appear. Weigh only when recommended, using the same scale at a consistent time each day. A rapid gain might suggest fluid retention, common in heart or kidney conditions. Record actual intake. Note coughing during meals or difficulty swallowing. Watch urine frequency and color. Very little urine requires prompt medical attention. Track sleep quality. For mood, watch for withdrawal or increased irritability. Suicidal thoughts or immediate safety threats always require emergency help. We must also recognize deterioration across different body systems. Let's look at red flags. These include signs of infection, breathing issues, and changes in intake or skin. Sudden confusion or behavior change is a major red flag called delirium. Unlike gradual dementia, delirium develops over hours or days and may fluctuate. The person might be agitated or fearful. Never assume confusion is just old age. Quiet delirium is easily missed. The person may simply appear sleepy or withdrawn. Call 911 immediately for stroke signs like facial droop or slurred speech. Also call for severe breathing difficulty, seizures, collapse, or inability to awaken. Watch for signs of infection like fever, chills, or a sudden decline in function, confusion, clammy skin, and a fast heart rate with an infection may signal sepsis. One skipped meal might not be alarming, but multiple small changes are a different picture. When small changes happen together, they often signal major deterioration. When you notice a change, communicate clearly using the SPAR framework. State the situation and background, then provide your assessment and request. Example, my father became newly confused. He is usually oriented, but started an antibiotic. He is weaker and has a fever. Does he need emergency evaluation? Before calling, have the medication list, diagnoses, and vital sign log ready. Report the exact onset time and repeat any instructions back to confirm understanding. Choose the right level of help. Routine review is for stable trends like appetite changes. Use urgent care for prompt assessment. Call 911 for life-threatening emergencies. When in doubt, Call their doctor is excellent guidance for non-emergency uncertainty. But don't call the office first if emergency signs are present. Go straight to 911. Let's finish with a quick knowledge check. You'll have 5 seconds for each question. Is sudden confusion a normal part of aging? No, it requires prompt assessment. Now, why is the baseline so important in caregiving? Because a meaningful change is the earliest warning sign. Which 4 trends should caregivers notice? Weight, appetite, sleep, and mood. Remember the 4 key takeaways. Sudden confusion is an emergency. Track weight, appetite, sleep, and mood. Know the baseline, and when in doubt, contact the clinician unless it's a 911 emergency. Your careful observation can shorten the time to treatment. Thank you for completing Lesson 14. Be sure to download your lesson workbook, notice, compare, document, and communicate. This course provides general education and is not medical advice. Follow the person's care plan.